welcome back. This is the AM show, and we're moving on to a very important conversation this morning. Now, doctors treating children with cancers say they're concerned about the increasing number of cases in the country. More than 1,200 children under the age of 15 are estimated to develop cancer in Ghana each year. Some of the common cancers we're looking at include leukemia, lymphoma, retinoblastoma, Wilms tumor, soft tissue sarcoma, and neuroblastoma. Before we get into a conversation here in studio, here's a report by Mamiesi Thompson.
10-year-old Bright had come with his aunt for follow-up checks at the oncology daycare unit following a removal of one of his kidneys. In 2019, he was diagnosed with Wilms tumor, a cancer that attacks the kidney.
I went to some human house, then I was not wearing dress. Then they didn't. Then the woman saw it. Then they say, then he called my father. Then my father come and saw it. Then they say we should go to Tamari. We come to Tamari. They say they can't treat us. Then they send us to here.
Shortly after he was referred to the Curable Teaching Hospital, his father died, and his mother abandoned him in the care of his auntie, Blessing.
We were there when we realized that one side of the abdomen, the left part, it was like a boil on it. And my mom and dad decided that it's just for herbal treatment, local treatment. And they sent him to the herbal. When they sent him, he was there. They've tried their best, but it couldn't work. When he returned back home, if he's going to urinate, you see that it's blood. That was the time my mom and my dad decided that where it has gotten to is not for just local treatment. They have to go for medical to check and see what is going on. When we got here, we followed the procedure. They started the treatment. Everything, it was fine. We went through the surgery. It was fine. We went for radiotherapy, or it was okay. And we finished our treatment. That was on last year, December.
Bright is among 1,200 children who develop the condition in Ghana every year. At the oncology department, another child, 13-year-old Gabriel, is battling leukemia. In a matter of a year, he had undergone several tests, chemotherapy, and dropped out of school.
They do operation on my ear, and they took the tinsam. They took him to pathology. Then they tested. They started giving me the medicine. Then the thing gone. They say that if I finish the treatment before I'll go to school again. Yes.
When you don't go to school, how does it make you feel?
It's paining me. I feel like I should go to school.
6 weeks after Abna Nyamiche delivered Adepa, she noticed her eyes were jaundiced and quickly sought medical care. Adepa was later diagnosed with retinoblastoma, a cancer of the eye. At 6 weeks, I realized she had something yellowish on her left eye, and so I brought her quickly to Curable. It was there that she was diagnosed of eye cancer. She had her first surgery at 2.5 months old. Now, her left eye has been removed and she's okay.
And I'm here surgery. Yeah, surgery now 2.5 months.
The only reason we're able to treat the majority of these patients is purely based on benevolence of organizations.
Dr. Lily Gloria Tego is training to become a pediatric oncologist. She tells me that treating childhood cancers is very expensive.
So it depends on the type of cancer and the stage of the cancer. So for some of our cancers, you may need as little as maybe 2,500, and for another, yeah, I'm saying little in relative terms to what I'm going to say next. For another, you may need as much as 40,000.
Lack of funds forced more than 50% of sufferers to abandon treatment midway. Lifeline for Childhood Cancers, Ghana, is one of many benevolent organizations supporting families with treatment. They fund treatment and medication to hundreds of children, including Adepa, Bright and Gabriel. Ekuya Sapong is executive secretary.
And the last thing any woman, any mother thinks about is that my child has cancer, so I need to escalate it. So it's mainly because of that that we get the very late cases. And so for Lifeline, we do a lot of awareness creation, speaking to the general public, anybody who would listen, on understanding and identifying the early warning cases, you know. We also do advocacy. So currently, childhood cancer is not covered under the National Health Insurance.
And that last statement, they're very indicative of what the situation really is like. Childhood cancer is currently not covered by the NHIS, and I'm sure you can imagine how much it costs to treat cancer in children, everything that has to go into that. Well, the Curable Child Health Unit and other stakeholders are collaborating to raise awareness this month. They also need to raise funds to support treatments as well, especially because it's not covered by our National Health Insurance. So in studio joining me this morning, I have Dr. Chidema Ononodu. She's a medical doctor at the Curable Teaching Hospital Children's Unit, and Agnes Kujo from the Tema Supreme Leo Club. Good morning, ladies.
Good morning.
Really great to have you in studio. Let me start with you, Chidema. Childhood cancer is not really something that we talk a lot about, one. It's also not something we really think about much, I guess, unless it hits you. I have 2 kids. I've never once, looked at them and thought about cancer. You're thinking about colds and, eye stuff and, itchy allergies, asthma, never cancer. Yes. Is that why you're seeking to raise awareness? And is it just that childhood cancer is overlooked completely?
Well, we are seeking to raise awareness because, just like you said, it's not something people easily think about. I mean, nobody wants to be told that their child has cancer, because people tend to see cancer as a death, sentence to the child. And we're here to tell people that childhood cancer can actually be cured. About 75 to 85% of childhood cancer usually can be cured, but then it depends on, if the child presents early, early, coming to the hospital early, picking up the signs early before the cancer has spread to the other organs. So yes, that's why we are here today. To
raise up. But why is childhood cancer so overlooked?
Well, I'd say that I think because, you see, like we're saying, the awareness is not there. That's why it's been overlooked. And because people think it cannot be cured. So maybe you're thinking, why would you pump in so much, money into this area if it can't be cured? But I'm sure if people hear that it can be cured, then people would start looking at it.
I mean, so when you compare childhood cancer to adult cancer, I'm not sure about the statistics, but I feel like for most adults, cancer is kind of like a death sentence. But, this morning you're telling us that in children, it's actually not. What's the reason why, most cancers in children can be cured as opposed to adults?
Well, as for the reason, I can't really say, because even telling you the cause of cancer, most time the cause is unknown.
Yeah.
Yeah, but children are very resilient. They're a very resilient group of people, and we notice that for them, sometimes, like what we watched, the child that was had a surgery, I think 2 months or something. For them, sometimes the cancer starts originating even before they are born. Yeah, and then we notice that the moment you pick it up early and it hasn't spread to the other organs, and you start your treatments, they are fine. And then these are children that have up to 50, 60 years to live.
Yeah.
So just get it early and, the child will be fine.
I mean, so the figures are about 1,200 cases a year.
Yes, that's the estimate.
That's the estimate.
Yeah.
Has it always been about this much, or is it are the figures going up?
So actually, the estimate is 1 in 500 children would have cancer in Ghana, and Ghana has about 29 million population. Yeah, so when you put that, you realize that about 200 children would get cancer before they are 15 years old. However, that's actually not the number of cases we see at Curable.
Okay.
Yeah, at Curable we are seeing about 180 cases. So that shows you that cases are being underreported, and we are not getting the actual statistics. So it means that we are missing a lot of children in the local regions and places where, you know, immediately a child gets something that looks like cancer, they don't go to the hospital, and then they tend to treat it some other way, and then the child probably dies.
Right.
Yes. So this is 1,200 is kind of an estimated number, but what we actually see is about 180.
And 8 cases. Agnes, let me come to you. In terms of reporting the cases of cancer, is it because, for example, in the rural areas or in you know, the outside of Accra and all of that, if it's not covered by the National Health Insurance, people cannot afford the health care, so they're not taking their children to the hospital, or even if they are, they can't afford to run the further test that will confirm the diagnosis, so it's just going unreported.
Exactly. So as we watched the video, it's not covered by the NHIS and it's quite costly. So parents tend to resort to herbal treatments. Yes.
Wow. Herbal treatments.
Yeah.
Is this after they've gotten a diagnosis, or they're just doing general treatments?
So the general idea that people have sometimes when the child's eye is yellowish in color, cough here and there, people tend to be like, well, it's just a normal cold. So they go to these traditional herbalists and get some medicine. But then as it goes on, that is when they go and then look for further treatment. I believe at that stage, doctor can tell us that it has already got
progressed. So then there's not much that can be done.
Yeah, well, I mean, we usually still do something, but then that is when it becomes so frustrating, and then you end up seeing parents abandon their children, like we watched. So there's a lot of cases of abandonment of treatments for some of these children.
Okay. When you said abandonment, I thought you meant that they were leaving their children in the hospital.
No. I mean,
they're
like
abandoning the treatment, so they just take the children away because it's become too
expensive.
How much does it cost? Like an average, you know, length of treatment. How much would that cost?
So, like, so I mean, every cancer is different. Yes. So you can have as less as 2,500 cedis. And then as much as 40,000 Ghana cedis over a 3-year period.
Wow.
Especially for a cancer like leukemia.
Okay, wow.
It takes about 3 years, So that's why some of them have to drop out of school.
For treatment, because they're in the hospital.
Because they're in the hospital.
They practically live there.
Exactly. There's a building there we call the Mother's Hostel, where they live, and then especially when they are coming from outside Accra. Yes.
Wow.
So.
That sounds so tough. I mean, can you imagine dealing with the emotional and the psychological burden of having a child who has cancer, and then you can't afford the treatment as well? I mean, that must be just something else. What are some of the cancers, the particular types of cancers that children are dealing with in Ghana?
Okay, so the most common ones, the first would be the lymphoma, which is cancer of lymphoid tissues, and the next would be the leukemia, cancer of the blood. Then you have retinoblastoma, cancer of the eye. And then you have nephroblastoma, which is cancers of the kidney. And then you have cancers of have some soft tissues in the body, the bone, which is osteosarcoma, and then brain cancers.
These are the cancers that children are dealing with?
Yes.
Wow. Is there a reason why we're seeing more of these cancers? I mean, even let us just take it away from just childhood cancer just for a second. Is there a reason why we're seeing more of these cancers? Is it that, you know, cases are being reported more, or are we doing things more that are causing these, you know, these cancers to kind of thrive?
Well, one, I think cases are being reported more.
Okay.
That's one. But then also, I mean, like I said earlier, the causes of the cancers are not always known. However, we still have some, you know, factors that, you know, help or add or contribute to cancers, like environmental factors. You have radiation is one, and there's a lot of radiation now as compared to, you know, before. Then you have some of the infections associated with cancer, like hepatitis B, Epstein-Barr virus, and then HIV.
Right.
They are associated with cancers as well. You have some medications, and then pesticide exposure in the environment.
Okay.
Is also associated.
So some of
with
these
cancers,
things are
yes.
Okay. So what do you need? What do you need to be done? What do you need the government to do? What do you need parents to do? What do you need the media to do? Like, how do we, change the narrative of this and just make, caring for children with cancer easier?
Okay, so first of all, we are advocating that cancer treatment should be put on the NHIS scheme.
For children or for
children,
adults? Okay.
Because it's very costly, as Dr. Riley said. And Ghana is a middle-income economy.
Basically, we are broke,
yes.
yeah. Basically, yeah.
Just a few of these parents can afford to do the treatment. So we are advocating that we want the government to put it on NHIS, even if not the full treatment, at least.
Some,
yes.
Yeah, at least some.
And then also advocacy. When we keep on encouraging parents, the fact that you see that your child is coughing or has reddening of the eye, a little blisters here and there, doesn't mean you should always go and get some paracetamol or whatever it is, but then you have to go for checkup just to find out if the child is okay. As doctor said, if it is seen early, at an early stage, then much can be done about it. So basically, we are creating awareness for parents to know that, well, if they get to know that their child is diagnosed of cancer, they shouldn't abandon the child. As some communities see as devilish, like, yes.
Right.
So, oh yes, statistics have shown that some parents, when their children are diagnosed with cancer, think that the child is, how do I put it, witchcraft or anything, yes, of that sort. So it results to abandon of the child. We saw in a situation of the 10-year-old boy, the parents, dad passed away, mom has run away. Why? We don't know the reason, but this could be some of the reason. So we are here to let parents know that it can be cured. We can help the children, as Dr. Riley said. So let's do our possible best and help our children, our sisters and brothers as well.
Okay. So I think the biggest thing is really getting the government to put some part of the costs on the NHIS.
Yes, that's one of the major things we are advocating for.
How much of a difference would it make?
Oh, it would make a whole lot of difference. It will make a whole lot of difference.
Okay.
Because
I want you to paint it out for us, because sometimes when you're appealing to government to do something, and remember that they're hearing so many appeals, teachers want their salaries raised, this wants this, this wants this, this wants that. But sometimes it takes, one story of how, 2,000 CDs or 3,000 CDs, which is something that somebody could spend in an hour, could really make a difference to family, So I really want you to paint a picture of how much of a difference it would make, to the lives of maybe one of your patients or two of your patients, so that we can actually really catch their attention. Otherwise, there are a lot of people screaming, at the government to do a lot of things. And so we have to, do you get what I mean?
Yes.
Yeah. So how much of a difference would it make?
Okay, so, for Gabriel, like we saw in the video, I actually know Gabriel.
Okay.
I was actually there when Gabriel was diagnosed, and then when he started his chemotherapy, and I've seen him make a lot of progress. And it's actually been amazing watching him, and he's actually been taken care of by his grandmother.
Wow.
Yeah, at the mother's hostel. I think since he came in, that was last year, he hasn't gone home. Okay, so somebody like Gabriel, who we can see really wants to go back to school, if let's say his grandmother for some reason runs out of finances or out of people helping or supporting, then what happens to Gabriel? Yeah. So if his grandmother can have some assistance by maybe some medications on insurance, some of the labs, because not just medications, they are doing labs, they are doing investigations, and all this costs a lot of money. CT scans cost about 1,200 cedis, and they have to do a series of this, to make sure that the treatment is working. They have to do MRIs, they have to do bone marrow biopsy. All these things are expensive. They are very expensive. So if something like bone marrow biopsy is on insurance, I think bone marrow is about 100 and something cedis. It would help.
It would.
Any little helps. Like you get it. Any little like assistance that they can get will go a long way to support, to show them that you're not on your own. I mean, we know that this is a problem in Ghana, and we know that we are willing to support you. You get what I mean? Yeah. So I think any little would help. The government, especially putting it on insurance, to tell you that some of these things are free.
Yeah.
You get me? Because you're writing the labs for them. Like you're writing the labs for a child that has malaria. And then you can tell the mother that, okay, look, so full blood counts and malaria and blood film for parasites is on insurance. And you already see a smile on their face. They know they're not paying for something.
Yeah.
But in this case where you're writing all the labs and nothing is on insurance, everything has to be bought with money.
Yeah. Yeah. That's a lot.
Yes.
I can imagine the number of parents who may have come to you and you've written out the labs and they've walked away with that piece of paper and never come back.
True.
Never come back because they don't have the money
to
pay for these labs, and so they take their children home and then they die.
True. That's what happens.
Yeah.
That's what happens. Sometimes we actually have to keep them, we do a lot of counseling in the oncology unit, a lot of counseling.
You keep the children, kidnapping the children so that the parents can go and look for money and come and do it.
Exactly. We have to keep counseling and encouraging them that, and sometimes too, we try to support as even healthcare professionals. But,
how much can you do?
Exactly.
Right, yeah, how much can you do? Oh gosh, okay. Well, that's a difficult one, but thank you so much for coming to talk to us about it. And I mean, of course, we will, talk about it as much as we can and try to get, the awareness out there. I think some of the most important things that you said is that childhood cancer is curable.
Yeah.
So take your kids to the hospital. Can you just, for a minute, just talk to Ghanaians about self-medication? Like, can you just, while this is also to do with the cancer, but can you just talk about self-medication? Because we are just like consultants, doctors, everybody in the house. Like somebody, if your child falls sick, you diagnose them, you treat them like...
I know, right? I mean, we are all guilty. That's number one. I think we're all guilty, but we should talk about it more. If there's, something like your child is having persistent headache for over 2 weeks, I don't see any reason why you should be self-medicating still at home. That could actually be one of the early signs of cancer. And then there are other things like you have an unexplained, like if your child is just losing weight and then you feel like, oh, maybe he's not eating well, but you should check it out. After a couple of, you should check it out.
Check it out.
Yeah. So I think self-medication, Ghana, it's not the best.
It's not the best, but thank you so much once again for joining us. And this is an appeal, of course, to government to put childhood cancers on the NHIS. A lot of parents who cannot afford care. There are a lot of children and future leaders who are dying because their parents cannot afford what it takes to get them a cure. And childhood cancer, 75 to 80% is curable. So let's do something about it. Let's make a difference. A very big thank you to you, Dr. Chidima and Agnes, for joining us. Your final words. Okay, you have final words. Okay. All right.
So as part of raising awareness, the Lions Club International is partnering with PZ Cousins.
Okay.
They are camel antiseptic product. So for each camel product you get the antiseptic.
Okay.
10 pesos goes into the coffers of Curable Teaching Hospital.
Okay.
The childhood cancer unit.
That's fantastic.
So entreating and encouraging all persons. Even you.
I will.
Get one for yourself.
I will.
Your children.
My ancestors, my unborn children, everybody, yes. Just to help a cause.
Yes.
So, okay, is it any of the PZ Cousins products?
No, the camel antiseptic.
Camel, that one specifically.
Yes.
Okay, all right. So if you want to donate and you're not sure how to, you can do this. You can buy camel antiseptic products and 10 pesos will go to the Curable Teaching Hospital. Is there any way that people can actually just directly donate?
Yes.
Okay.
So we have some mobile money numbers made available as well as bank account numbers.
Okay. So we will put that up on the screen when we come back. Because we don't have them, do we? Oh, we do? Yes. Okay, so Echo, if we could put that up on the screen, that would be great. Or you can pop by Joy FM. As usual, we'll direct you to the right places. But let's make a difference this year to some child somewhere who is in pain and needs your help. Do you have some final words as well?
I do.
Go ahead.
Okay, so I want Ghana to know that childhood cancer is curable, and early diagnosing is key to curing childhood cancer. So please, let's endeavor to take our children to the hospital, especially when we are not certain of something and it's taking way too long.
Okay. All right. Well, thank you very much. Agnes, can you quickly run through the numbers, the Momo numbers for us?
Okay.
Okay, go ahead. You don't have them off here. Okay, all right. And we'll come back with all those details, but we're taking a quick break. When we come back, we'll give you the details so that if you would like to donate, you can. And IB will be bringing us the showbiz news. Don't go anywhere. This is still the AM show.